So first of all, I'd like to thank Molly and her team for inviting me here today, and it's great to see so many people making the effort to learn about interdisciplinary research and also to find out more about this whole funding stream and developing the research and progressing your research. As Molly said, I am literally 2 weeks in Limerick, so I'm brand new to Limerick, so a lot of all of this work mainly has been done in DCU, so I obviously have DCU there as well to acknowledge their input. So I got an email from Molly, and it said this is what she wanted me to work on. So she wanted me to I encourage you to focus as much as possible on the process which you have used to encourage successful interdisciplinary research, as this is the primary focus of the event. So what I'm going to do over the next few slides is take you through the journey we went through to actually come up with an interdisciplinary project idea and make it work. So the first thing I would advise is begin with a real research problem and challenge. Now, what do I mean by that? It has to be concrete. It has to be something that has been recognized as an actual problem. And you can see here, this is from the first physical activity series published in The Lancet in 2012, just before the London Olympics, published a second series this summer as well, before the Rio Olympics. And it basically is drawing our attention to the pandemic of inactivity, and specifically its far-reaching health, economic, environmental, and social consequences. So we know we have a problem. We know that this inactivity is contributing to non-communicable diseases. In actual fact, it's estimated globally to contribute to between 6 to 10% physical inactivity to NCDs. And this is articulated through things like coronary heart disease, diabetes, breast cancer, and colon cancer. And in actual fact, when you look at the statistics for Ireland, they're actually even higher again. So we have a problem that is leading to health consequences. And we have a global mandate to work on this. So for example, the World Health Organization's Global Action Plan has indicated that by 2020, they want a 10% reduction in the prevalence of insufficient physical activity. And at a European level, the recently published physical activity strategy actually feeds into that. So there is a problem there, that's one. Two, find a potential solution and something that works in practice. And this is an example of a community-based chronic illness rehabilitation program that was run in that is running in DCU. And you can see here Dr. Noel McCaffrey teaching and myself teaching. And basically what we did, this is running now for 10 years. What we did was we got involved at grassroots level and understood what was needed to change behaviour. And we actually were teaching classes, meeting the participants, and over time and observation, one, we found out it worked, and two, we found out the determinants of what made it work. So we had a potential solution, one that had a broad appeal. So make sure your solution has broad appeal both in practice but also in policy. And you can see here that we now have worked to make a national programme with the National Exercise Referral Framework, and there are lots, or at least we're getting there with community-based chronic illness rehabilitation programmes. There's one in NUI Galway, for example, and there are others throughout the country. But with international appeal, something that is internationally recognised. And here you can see Noel standing there at the back, and I'm down there somewhere as well. But this was a group, Sally alluded to it, knowing that the work that is done is good. And this was a group that was drawn together by the World Health Organization to look at the whole area of exercise as medicine, tackling inactivity to reduce non-communicable diseases. So you have a problem. You have a potential solution, find the gap. Is it working? What's missing? And what we found from observation statistics was for every person who attended the community-based chronic illness program, 5 people didn't. So we had a 20% rate of getting people to the programs. If we can get them to the programs, brilliant. But that is not the only solution. And this was our challenge. So the problem turned into a challenge. Now, meet it with an interdisciplinary core. Put an interdisciplinary core around it to find your solution. And DCU, maybe unbeknownst to itself, put these 3 people on a plane to Arizona State. We were going out to Arizona State University, and we were sitting right beside each other, and it's a very long flight. And by the end of that flight, we had you can see Professor Noel O'Connor there on, I think it's your right. His area was technology. He was a technologist, and he was interested in technology architecture, technology integration. A lot of it I didn't understand, but he was also very interested in physical activity. He was also very interested in exercise. On the left, you have Dr. Kieran Moran, who was an exercise scientist and very into performance, but he understood that technology could help with movement analysis. And I was in the middle of the two guys, and I knew we had a problem with medics. We needed the reach. We needed a home-based program, and why don't we try and find a technological solution? So the three of us discussed the problem and came up with some potential ideas. But my advice here is you need people that understand research. They have an idea of practice, but they understand research and have a research focus, and they know what a research program entails. Ideally, you want people who have some experience in Horizon 2020. We were very fortunate that Noel had coordinated and led successful Horizon 2020, or FP7 bids at that stage. He knew the process, he knew the lingo, he knew how you actually understood the intricacies of the application process. I had led an FP7 project. We got through to stage 2, but we were ultimately unsuccessful. It was a very different project, but what I learned about that was a lot of what Sally was saying. It does boil down to you writing and doing a lot of the work, but you need to put good people around you. And Kieran, who had been involved in an FP7 project, had not yet coordinated, so he was the newbie, so he said, right, I'll lead it. So he stood up and he said, I'm going to be the coordinator. I will lead this project. Myself and Noel said, brilliant, we'll support you. So now you had a team of 3 people that understood 3 very different areas very well in one institution, and the search began. So we decided to apply for the Horizon 2020 Health Innovation Call, and we came up with technology-enabled behaviour change as a pathway towards better self-management of cardiovascular disease. And what the idea was, we wanted to ultimately prevent people being sedentary at home, having a coronary incident, going to hospital and going through the stages of cardiac rehab, which is phases 1, 2, and 3, then going home and returning or reverting to a sedentary behaviour. That's what we wanted to prevent. And we proposed to prevent that through helping people to become active within their own homes via technology solution. But from a physical activity perspective, within your own home is not the only solution. We want them to be outside and be active if they choose that. And ideally, what we found worked in medics was the importance of social support. We wanted them to be able to connect and link to others so they weren't isolated. And ultimately, we wanted to bring the feedback loop again, so you'd have the person, the healthcare provider, and the exercise all linking up to help with self-management. So we got 11 partners from 7 different countries. And these are a mixture of technology partners, physical activity partners, public health partners, and that's it, I suppose. So for example, you have up there, you have CERT ITI, which are specialists in sensors. You have INAB, who are specialists in decision support systems. You have Glasgow, who are specialists in economic evaluation. You had Leuven, who were specialists in the cardiac rehab from the physiology perspective. You had DCU, who was leading in the physical activity from the psychology perspective, and so on. But each partner was carefully selected because of the contribution they could make. And we don't overlap very much in terms of what we do, but we all understand the challenge and the need to work together. So the Pathway Consortium kickoff meeting happened in March 2015. So we're just about a year and a half into, it's a 44-month project. So how do we get, so now we've got the idea and the team, how do we get them to work together? What is the process that we use? The first thing you do is you convert your consortium into a team. That's the first thing you have to do. And you can see here that at our first consortium meeting, we actually went to a cardiac rehab class and we all took part. the whole team. We tugged out in our shorts and t-shirt, we met the older adults that we were working with, and you can see here in the middle, I don't have a pointer, but Rosaline and Veronique here with the Nike stripe, they led the class, they taught the class, and we did it. We took part in the class. And you have Dave here on this side. His area is technology. And he's looking at integration of technology systems. Beside him, you have Paolo, who's an architect or an engineer. Then you have Demetrius, who's on decision support. And these guys are going, like, physical activity isn't their bread and butter, but now they had a genuine understanding and respect of what it was we were trying to do. Second of all, infrastructure. Really, really important. The grant agreement. And this, Sally referred to it as your deliverable or your program of work. This is really important. So you write the grant agreement, you put it in place, but when you're doing the interdisciplinary work, it's making sure that you stick with this to make sure all of the deliverables are met on time. Now, in order to do that, I don't understand the technology, so I need someone on the team that I can talk to that understands the technology. So within our infrastructure, Kieran is the coordinator, I'm the clinical lead, and we have a guy called Petros Daros who is the technology lead. And the three of us form the project steering group that actually works with all of the other people on the team to help deliver on the project. And the beauty of that is we can talk to each other and translate what's happening on the ground. Use project management tools. We don't have a management company, we run it ourselves. So we rely on, for example, we use Basecamp as a project management tool, but this is really important for sharing documentation and making sure that you can go back and check what people are doing and so on. We use Skype because I spend 2 hours a week at least on TCONs and communications, talking to partners in Greece, talking to partners in Italy. You know, we do an awful lot of work through talking, going through things, explaining them again. Face-to-face meetings are essential. I'm going to Greece on Monday for our next consortium meeting. It sounds lovely, but in actual fact, I don't know how much of Greece I'm going to get to see because a lot of these time you spend in meeting rooms, but they are actually really, really important. One, to ensure progress is being done, but also to build the network among the team, to get to know the rest of your team and to build this partnership. And obviously through dissemination. So the infrastructure that you put in place from the word go is really, really important, and making sure that everybody understands and uses that infrastructure. Build a common language. And here, you know, you have your plan, your project plan, and that's the end point. In reality, there are lots of different challenges. So for example, in technology, I had to understand what HDMS meant. It's health data management systems, but they use lots and lots of short acronyms, and you're going, what? And you're writing them all down. GUI, use case scenarios. They have pare back everything to the bare basics. We say, yeah, you do this. No, how do you do it? Very concrete steps. In behavior change, we were talking about patient-centered approaches. We were using phrases like combi, and they were going, doesn't really mean anything, translate. And in exercise, what were our algorithms, teaching points? These were all different languages, all in English, but different languages that we were using. So you have to build a common language with your project. You have to build new knowledge, and this new knowledge helps you get over a lot of the barriers. So for example, one of the challenges we faced was, are people actually going to use this? Are they interested in this type of an intervention? So part of our first new knowledge was to actually ask the people who would be using this program, are they actually interested? And what we found was that in actual fact, these are individuals living with heart disease and either phase 2, phase 3, or phase 2 or phase 3. And what we found was that about 50 to 60% of people said they had medium to a very high interest. So we could show our technology partners that yes, there is a need for these technology developments among this population. Get used to presenting your data differently. As exercise scientists, we are very used to presenting photographs with teaching points underpinned and getting up and demonstrating. But as technologists, they want our data in spreadsheets. Excel spreadsheets and columns, they want it coded and numbered. So we had to translate our physical activity data to codes and numbers. So go with an open mind in terms of presenting your own data. You have to present your data simply. You might be talking about a theoretical model in relation, this is an example of the COM-B model, Susan Mickey's model in relation to behaviour change. But translate it simply. What does it mean in real terms in relation to what I am trying to produce? You have to understand other data from the other perspective. This was an example of a UML modelling system around the single exercise class that is part of the pathway process. And whereas I understand that one quite nicely, the technologists understand this one perfectly. So it's understanding different perspectives that you are coming from. Interface requirements, again, translating technology data into front end. This is an example of a front end, a draft version of our front end system, but again, translating that into usable data. And what we found from an interdisciplinary perspective that was really, really helpful was an iterative design process. So what we have done is we have built a system but gone back to our end users, the people who are going to be using this, not the researchers, the end users, and tested it with them again and again and again. And what this provides you with is a rationale to go back to the team and say, from an interdisciplinary perspective, this is working or this is not working, this needs to be changed. So the mandate comes not only from the research team, but from the people who will be using the system or the solution that you are proposing. And it provides validation from the researcher-developed intervention. For example, so in round 1 to round 2 of our focus groups, the prototype, the interface for the avatar-led intervention was this is an example of it. So the technologists went away and said, answered our call that we needed a interface that they could see the pathway program working. And they came up with this. And we showed this to cardiac rehab patients. And they said, no, the avatar needs to be clearer, simpler, more lifelike. For example, give it a regular BMI. Remove the distractions from the background and only have the heart rate. So, and for example, from my perspective, I'm saying, well, I don't want to see a car out there. It should be a bicycle or something like that, or trees. So the technologists went away and they came back with changes. And you can see here that on the top right-hand side, it's become much more simpler. The heart rate is now bigger and more prominent. There's much less distraction. The woman has moved from a short top to more normal clothes. We're getting there. We're working towards making the avatar more realistic. Ultimately, you need to translate your findings into project implications. So to summarize, start with a real problem or challenge, a concrete solution with broad application, an interdisciplinary core to scope out the question and plan the program of work. Then put your interdisciplinary team around you, with each having their own speciality and focus and contribution to make to the project. And make sure you've got good quality infrastructure, build new knowledge, a common language, constant translation, patience, perseverance, and ultimately respect for each other's work is really important, guided always by the end user, who you are targeting with your intervention. So thank you very much.